I think one of the things that stands out from these clusters is that most of these children have been children who are previously healthy.
Doctors at Mayo Clinic are trying to make parents aware of unexplained cases of hepatitis that are all starting to show up in small clusters around the world. They're wanting parents to look out for signs of hepatitis in their children while making sure to point out that we're talking about a very small number of kids so far. In fact, the World Health Organization calls this acute severe hepatitis. It's so far tracked about 200 cases around the world. 9 of them have shown up in Alabama, and so far in the state of Minnesota, our health department says it's investigating several cases. But we're talking about very young kids here. In Minnesota, the possible cases have been under 12, but worldwide, they're all 5 and under. But this is serious. 1 child has already died, and 10% of all of the cases worldwide, they've resulted in a liver transplant. 2 of those liver transplants had to happen in Alabama. So far, it's important to point out that all of these cases are unexplained. But there are some non-factors, and among them are COVID. Very few of the children have had COVID disease. The COVID vaccine, it also does not appear to be a factor here because most of the children, again, too young to be vaccinated. And none of the children had the viruses that led up to the 5 cases or different instances of hepatitis. The only correlation at the moment seems to be something called adenovirus. Now, this is a family of viruses, but they've noticed that several of the kids had a variety of adenovirus called adenovirus 41. Dr. Sarah Hassan of the Mayo Clinic describes what this is.
Adenovirus 41 is really common. It gets a really bad rep because it can cause diarrhea, but it's really common in that age group. So that's why we're saying, is it a red herring or not? Because it's so common. Can we say for sure that this is what's causing the liver disease when in the past it hasn't? So it's just something to keep thinking about.
And that underscores that even the best doctors don't know what's causing this. That's why they want parents to be aware of the symptoms of hepatitis, especially if they have yellowing around the eyes or even yellow or jaundiced skin. We're talking about a lot of areas here, and Dr. Hassan says there's another important sign to look out for.
Another thing that's really important to pay attention to is the color of the urine. If the urine is starting to look like it's the same color as tea, then this is alarming. The color of the stool can give us a lot of information. Sometimes lighter stools, pale stools, even clay-colored stools can tell us that there's something happening with the liver and it's being irritated or inflamed.
And if you notice those signs in your child, simply get them to their doctor. And while there is no known cause at the moment, Dr. Michael Osterholm at the U of M today said they can't rule anything out. In his podcast today, he says, "I don't know," is perhaps the most responsible statement to make from healthcare providers at the moment.